It's time! Your 65th birthday is just around the corner, and now is the time to sign up for Medicare. Or is it? Today on Health and Retirement, we talk about the ifs, ands, and buts about enrolling into Medicare and the different strategies we employ with clients to best time the transition from workplace insurance to Medicare. Welcome back, everyone, to Health and Retirement, golden advice for your golden years. I'm your host, Trey Basa, a licensed health insurance advisor with Market Medicare Advisors. And today I'm joined by my good friend and coworker, Cory Hiebert, also from Market Medicare Advisors. Hey, Cory, welcome in. Happy to have you.
Yeah, Trey, thanks for having me again.
Of course. Today, we're just going to be talking about some of the more delicate timing issues that we face with our clients, because not a lot of folks understand how these different enrollment periods work and what the timing works for them. Because a lot of times they'll come in, it's my 65th birthday, I'm ready to go. But that's not always the case. We always ask a lot more questions to get to know them and their particular situation.
Yeah, like we always know with Medicare, it's never been a one-size-fits-all type of program. You know, there's several different insurance plans that people choose to go into for their secondary coverages when it comes to Medicare. And just like there are so many different options for the secondary coverage, there's a lot of different options for when you can start your Medicare coverage or when you should start your Medicare coverage.
To kick things off on today's episode is our first segment, In the Know. Market Medicare Advisors is dedicating to keep you in the know with all things health and retirement. Our segment today is going to talk about the timing for enrolling into all things Medicare. So like we were talking, the timeline is very delicate. You have to be aware of all the ifs, ands, buts. So not everybody needs to sign up for their 65th birthday. What is that? What is that enrollment period?
Yeah, so for those of us that are looking forward to starting Medicare on our 65th birthday, we'll use what's known as the initial enrollment period, abbreviated down for the IEP. IEP, what you're looking at there is you're looking at a 7-month window. It's 3 months before the month you turn 65, the month you turn 65, or the 3 months following. And like any government program, there are some oddities that come with this. The only exception to what I just said is that if you're born on the first day of a month, your IEP you're actually eligible for Medicare the month before you turn 65 if you are born on a first.
Of course, it
so
just
that
can't
even
be
moves
that
that
forward.
timeline up. Right. Why make it so simple?
And folks' IEP is what the government, what these health insurance agencies, that's what they focus on the most, because they know you're turning 65, and that is the earliest they can get you onto Medicare. They want you to get on their policies right here, right now. So their birthday, their contact info, their names, they're getting flooded with all of these mailers, these phone calls, Facebook ads. Hey, you're turning 65. Now's the time to sign up for Medicare. And it's all because of that IEP.
Yeah, and I get the question all the time of, I didn't sign up for anything. I didn't click on anything. Why am I getting these ads? Why am I getting these mailers? When in all reality, Trey, I mean, you have a Facebook account. Your information is out there. It's not as private as anybody thinks that it may be. There are several different ways that people can get a hold of information, and as soon as they see 65s coming up,
Oh, they're just gonna hit you hard with the ads, the mailers, emails, phone calls, and unfortunately, it doesn't ease up after you get enrolled for everything. But that's where you and I come into play. We reassure our clients that, hey, this is the timeline that we talked about, that we had agreed on. This is what you need to do. You don't need to worry about anything else.
yeah, absolutely. The only other note that I would really have on the IEP is it's fairly common. I'm sure you see this within your walls that we'll get calls from people that I think the earliest that I've had was a 63-year-old that called
Okay.
me and wanted to get scheduled to come in and start talking about Medicare. And it's never a bad thing to start getting education early. Um, but really, outside of that IEP, I have people that'll come in and they'll get disappointed because maybe they'll come 4 months before they turn 65. And they'll be gung ho, they'll be ready to get signed up for everything, they'll want to be moving. And then it's like, we can't really do that right now because that IEP, it is a fine window. You have that 3-month period before the month you turn 65. That's when we can start doing making decisions.
So he talked about people's first opportunity to enroll, their initial enrollment period. But not everybody signs up at 65. We were just talking about how sometimes people come in a little too early, sometimes people come in late. What's that later enrollment period?
Yeah, well, the 65-year-old that's starting Medicare is becoming a little more of an oddity than it used to be.
I
And
agree.
the main driver that we see behind that is the fact that the full retirement age for Social Security just keeps on going up and up and up.
Hmm.
Currently sitting right about 67. So people are delaying their Social Security, and because they're delaying their Social Security to full retirement age, they're continuing to work and continuing to maintain their employer coverage. And if you do have that employer coverage, and I'm very careful with my words here, it is creditable coverage. You don't have to take Medicare at 65, and there are several reasons why you might not want to.
I think Social Security is probably the number one reason why folks delay their Medicare coverage. Number one, they just want to keep working. They want to build up their Social Security because that is going to be a huge component to their retirement funds. And I think number two, a lot of times people just they don't want to retire. They don't want to not be busy. They don't have a set plan in place to keep themselves busy post retirement. So they're like, might as well just keep on working, roll up that Social Security. I say, by all means, go for it.
Yeah, absolutely. The only thing to add with that, Trey, just a couple general guidances for delaying Medicare past the age of 65. For most people, as you do approach 65, we still strongly recommend applying for Medicare Part A only. Part A is zero premium, so you're not going to be paying a monthly expense for that. It's not really going to be super helpful in terms of insurance. It's not going to cover a lot of gaps that you're already missing.
Mm-mm.
But what it's going to do is it's going to make signing up for Part B much simpler later on if you already have Part A. The only time that we don't recommend signing up for Part A is if there are contributions that are being made to a health savings account or an HSA.
Mm-hmm.
You cannot contribute to an HSA while taking any part of Medicare. Again, just one of the particular rules that they do have. But along that note, the FSA or a flex spending account is still allowed.
Lots of hoops to jump through. So if you're thinking about signing up for Medicare, you have to take into consideration what the best time is for you to do it. If you have that idea to keep working, to roll up your Social Security, or even build up your health savings account, you have to consider these ifs, ands, or buts when determining when the right time to sign up for Medicare is for you. The last enrollment period I want to talk about is the annual enrollment period. So after folks have already signed up for all of their policies, we hit them. We hit our clients with some mail every year saying, "Hey, annual enrollment is coming up. We should probably sit down and talk about X, Y, and Z." What for our listeners, our followers? What is the annual enrollment period?
Yeah, so specifically with the annual enrollment period, we're going to talk about the two major things that are covered during AEP, and that's going to be Medicare Advantage plans and prescription drug plans. These plans, whenever they are built by private insurance companies, are on a calendar year contract. That coverage is good from January 1st until December 31st. Now, that next January 1st, you may still be on the same plan, but that plan could have completely changed their coverage. The medications you used to be taking may no longer be covered. The doctors you're used to seeing may no longer be in network. And that is why it is crucial for every single Medicare enrollee to get in during annual enrollment period from October 15th through December 7th to make some of those changes.
Every year, those dates have not changed.
Yeah, and just to go a little bit more in depth on that, I'd like to tell a quick client story.
Absolutely.
I had a phone call. It was first or second week of January with a client of mine that had been a client for going on 5 years. First 4 years was incredibly diligent on getting in during AEP. Only problem is that we had never changed his plan.
Yep.
His drugs never really changed. His plan never really changed. There was never a reason to. Now, he called me because he went to pick up one of his medications, and he ended up paying a lot of money out of pocket for something he had never paid for in the past. Well, come to find out, his plan had just dropped coverage of that one particular drug. Now, there are several other plans out there on the market that still cover it. The only problem is we can't change. Whenever
He missed his window.
after December 7th, you are locked in for the next calendar year.
And that's the hard part is we have to fit all of our clients in between October 15th through December 7th. But we have a team of advisors to talk with all of our clients to review their prescription drug plans to make sure that they're on the best fitting plan for next year. At the end of the year, that's it. Or at the end of December 7th, midnight strikes, calendar turns over to December 8th, we can't send in any more applications. We can't make any changes with our clients. That is why it is crucial to come in, not even with us, but with any of your advisors, to come in and talk to them about October 15th through December 7th and your prescription drug plans, your Medicare Advantage plans. Because if you don't have that review, it will come back to bite you. Just like Cory's 5-year client, he didn't review it the one time and it ended up biting him in the butt. If you want to stay in the know with all things healthcare insurance, or perhaps have a professional review your policies, give us a call at 833-MAG-REPORT. That's 833-624-7376. Or you can email us at mail@marketmedicareadvisors.com and connect with us today. Our next segment for the show is going to be the client case study, where we break down and explore a client case we're actively working on. A very familiar couple we see a lot of here in Wichita. Not one couple, but just the idea of this couple. They've been in the aerospace sector for a while. Now that it's time to retire, they're leaving Wichita. They're leaving Kansas. And by all means, they're trying to go to their vacation home a lot more, or visit friends, family outside of the state, or even sometimes just moving altogether. What is it like for folks that move from here in Kansas to, say, North Carolina or Florida for the rest of their retirement?
Yeah, so if we're talking about a permanent move, your Medicare supplement that you have is typically going to go right along with you. Its price may change depending on a different state's guidelines and how they price out the policies, but the company that you're getting the coverage through and the coverage that you're getting, those things are going to stay right the same. But what will always change, and what is always based on a zip code, are going to be your Medicare Advantage plans or your prescription drug plans. Those are zip code coded and down here in Kansas, we want to be extremely grateful that they are, because your prices are going to be higher in some other states compared to our state in terms of co-payments, and we're pretty thankful for that. But if we're talking about just traveling and not necessarily a permanent move, your Medicare Advantage plans, these are from the larger insurance companies. And they tend to not isolate you down to a zip code network, but allow you their national network of doctors.
So still getting some out-of-network coverage.
Well, you can definitely have out-of-network coverage, but even if, just for instance, you're with insurance company A here in Kansas, and you go to California, and there's a doctor that still accepts insurance company A, you're going to be in network.
There we go.
It is not specific to the zip code. Same thing with prescription drug plans. If you're getting your drugs from some of the larger pharmaceutical providers, you can pick those up pretty well any location in the United States, especially if it's just traveling and not a permanent move.
We talk a lot about moving and retirement, but I just wanted to talk about what it's like to have these Medicare policies when living out somebody's best life in retirement, because not everybody's going to be a homebody. Not everybody's going to travel. What is it like to have these policies? So make sure that you understand what policies you do have and how they operate outside of XYZ zip code, or how they operate in different states entirely. If you have a question we should focus on here on the show, or a case we should explore, write us at mail@marketmedicareadvisors.com, and be sure to give us your name and city so we can shout out you on the show. And as always, you can give us a call and schedule a meeting so we can get to know you and your situation just a little bit better. Because if there's one thing I know, it's Medicare is for the individual. Not every individual is the same. That will be it for today. Be sure to subscribe and stay tuned for more videos just like these for all of your Medicare needs. Don't forget to like and share so you can help your friends and family by getting them the information they need to know about the Medicare premiums, policies, usage. You can catch the show and our entire catalog of shows on our channel, youtube.com/@retirementhelp, where we archive all our previous recorded and aired shows with professionals from the healthcare to financial to estate to tax sectors as well. All of us coming together in one place to talk about how we're actively working with clients today to prepare them to live their best lives in retirement. I've been your host, Trey Basa.
And Cory Hiebert.
Thank you so much for joining us here on Health and Retirement, the talk show of golden advice for your golden years. We'll see you next time.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed.
The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers.
This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options.
Investment advisory services are offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor. All rights reserved.